So one question is, how does APOBEC 3b have a clinical impact? And one can essentially measure that different ways. One way in breast cancer that we've looked at is if you take a primary tumor specimen and then measure APOBEC 3b levels in that tumor specimen and then ask how the patient does over a longer term, the cohort of patients whose APOBEC expression levels are lower do much better than those who have APOBEC expression levels higher. They do much more poorly. Similarly, and so that's in a cohort that was only subjected to surgical resection as the primary frontline care, and that was fortunate because the actual specimens were collected decades ago, and so we could do a retrospective study. In a similar retrospective study, we could look at estrogen receptor positive breast cancer. And in that particular study, we could again go back to the primary tumors and ask whether APOBEC 3b levels predict outcomes in the recurrent setting. So after tumor resection, some point after this particular cohort had a recurrent ER-positive disease. And in that case, the primary tumor APOBEC 3b levels also predicted outcome. Those whose tumors had low levels of APOBEC 3b did really well over time in terms of disease-free survival. And those whose tumors had high levels of APOBEC 3b invariably, or not almost invariably, did not respond to tamoxifen therapy and had very poor outcomes.